Good morning. We want to welcome you this morning to the Drainage District Board of Directors meeting posted for today, October the 17th, 2017. Present are Commissioner Fuentes, Precinct 1, Commissioner Flores, Precinct 3, Commissioner Palacios, Precinct 4, and myself. We have a quorum. Please join us in prayer.
Thank you, Judge.
Good morning. Please bow your heads for prayer. Heavenly Father, come to you today to thank you. Thank you for this opportunity to come together as citizens for Hidalgo County. We thank you for the wisdom for all the decisions that will affect this court and all of us as we stand here today in recognition of so many great things that have happened in this community. We thank you for this opportunity to recognize everybody that's here today. Help us to continue to do what's best for this county and for each other, and to do what we can in community service in every way possible. Lord, ultimately to glorify you and lift you up, and so that everything that is done in your name. We ask for your blessings and your guidance. In your mighty name we pray. Amen.
All right, under open forum, anyone sign up? Yes, first presenter is Norma Aldape.
Buenos días, mi nombre es Norma Aldape, vengo de Lupe, vivo en el área de Mercedes. Esta mañana solamente quería venir a dar las gracias a nuestro comisionado Fuentes por haber asistido a la gala, a nuestra recaudación de fondos de Lupe. Muchas gracias por apoyarnos, comisionado. Y también a dar las gracias a Mr. Cecín y a Mr. Fuentes también, porque mañana tendremos una junta ahí en el precinto. Muchas gracias por apoyarnos siempre a nosotros, a nuestras comunidades. Gracias.
Good morning. My name is Norma Aldape. I live in Los Olivares Acres. I'm a member of Lupe, and I'm here this morning just to thank Commissioner Fuentes for supporting us in our effort and our biennial fundraiser, blank out, biennial fundraiser, and thank you for Mr. Cecín also for having us tomorrow, for willing to meet with us. Also, Mr. Fuentes, for you hosting us, Commissioner Fuentes, for hosting us in there. These meetings, trimester meetings, is very important for our community to continue to have dialogue and continue to be transparent. Thank you.
All right, next presenter is Sared García.
Sí. Buenos días a todos los comisionados y a usted, señor presidente.
Gracias. Buenos días.
Hoy vengo estoy primeramente que nada muy súper contenta porque a donde quiera que voy me hablan de nuestra gala, de la Unión del Pueblo Entero, que fue un éxito y que aparte tuvo unos speakers muy bonitos, muy, ¿cómo le dicen? Muy motivadores, y que todo estuvo perfecto, empezando por nuestro programa que estuvo casi perfecto. Y le quiero dar las gracias al señor comisionado Joseph Palacios, a usted por sus bendiciones, por su apoyo. En realidad, a todos ustedes los queremos presentes, si ustedes quieren, dentro de 2 años, porque esto fue algo inolvidable para nosotros como miembros, como líderes, y creo que para las otras personas fue una gala de mucho corazón y de mucho apoyo mutuo para nuestras comunidades. Y nada más le quiero hacer presente, no sé si se lo dieron a usted, pero se lo voy a dar, este programa que estuvo muy bien diseñado y hecho, se lo voy a dar a la señorita para usted hacerle presente. Y eso es todo, muchas gracias. Los líderes y los miembros de Lupe y los trabajadores le agradecen todo su apoyo brindado. Gracias.
Good morning to all the commissioners and to the judge. My name is Sared Garcia, and I'm here on behalf of the members, the Lupe and the and the staff of Lupe, just to thank specifically Commissioner Joseph Palacios for sending your staff to our gala. It was a great gala. We had great speakers. It's a really way for you all to support our work that we do the whole year, and we're really happy with the blessings that you send us and all the support that you give us through the year, but especially through this event. We hope that all the commissioners and the judge in 2 years will be there with us, because it's such a really good event for our community, especially for the members who are there. They feel very empowered. So I just wanted to share this morning to see the program, because it was such a great program that we would like to share with Commissioner Joseph Palacios. Thank you so much for supporting us in this event.
Thank you. Any concerns with the consent agenda?
No, Judge. None that I'm aware of.
Need a motion to approve? Need a second?
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Thank you, Judge. Item 5, discussion, Alcohol Drain District No. 1 project maintenance and operations. ACD No. 1 drain system / illegal dumping, trash drainage improvements. You know, a lot of times I get up here and make presentations on projects and don't have any type of visual aid, so I felt that maybe for the benefit of the board and the public to kind of just talk a little bit about what we're doing, and then also bring out some of our biggest issues, which is illegal dumping. This is an area here in the Sioux Road and Tower Road, and got some press about flooding and so forth. So we went and looked at it and evaluated what was happening, and you can see there that's our crew working to remove a pipe that was basically clogged, and you can see it's full of trash basically. The whole pipe itself is full of trash, so definitely the water's not going to flow when it's full of trash. So you know, illegal dumping is not just in the ditches, and you'll see some slides here in a minute, but it's also inside the neighborhood on the curb and so forth. The system's not designed to take all that trash into it, so just wanted to point that out for the benefit of the board and the public, that it's important. This is a lot right here in the subdivision, right there, and that's right next to one of our drain ditches that eventually makes it into the drain ditch and clogs the pipes and so forth. So this is real important as well. You know, I know we have a division that's looking at this, but we definitely just want to reach out to the public and stress, you know, the importance of keeping it clean and making sure that system doesn't end up in the pipes like you saw before in our system. This is right here, another ditch right there, probably, I don't know, 40 bags or trash bags there, and floating and so forth. Again, you know, this is a system that we're getting ready to take over through an interlocal, but still, it's still a drainage ditch. It's not our system yet, but it will be. But I felt the need to point it out because we had to clean it up. We got the interlocal executed already, and we're starting to improve that system. So obviously, you can see with that amount of trash, what happens here. You can see the clogging of the ditch right there. That's another ditch where it's affected as well. So, you know, just wanted to point out some visual aids to kind of get a real good feel as to when we say illegal dumping and what happens. Yes, we do our best to try to improve our system, keep it clean and maintained, but, you know, we need the help of the public to help us do our job. And you know, our job is to basically expand our system and to try to manage the waters that come to us and move it efficiently out of our area. When we have issues like this, it's very hard to. So, and then just to point out some of our drainage improvements we have. This is a before picture there. You can see the ditch itself with the lining of the trees on the right side next to a canal, and our ditch on the left side that we're working on right now. That's a before picture, and then this is also go back, please. That's a before picture as well of the system itself, which you can see. And when I come up here and I present projects that we're doing, this is what we're working with right now, which, you know, is still a good system. It's efficient, but we've been focusing on when I say that we're creating bench systems to facilitate maintenance, but also create more capacity. You'll see now that's right there, that same picture. Almost double the capacity in the system itself, you know, so you can see where we have the step there. We have a wider system to accommodate more water. And again, it's a maintenance and operation because we're trying to create a maintenance system or an easier system to maintain. So, and the next one, And that's just an aerial view right there. That's an area there in the 493 and 107 which was affected in the past. So we've been focused, and this is just a couple of pictures. You know, we have several pictures of different projects, different areas. And, you know, we've always tried to, since I've been there for the last 2.5 years, almost 3 years, to focus on areas that we know we've had issues, to expand our existing system with the existing right-of-way, create more volume, and at the same time facilitate the maintenance. But just wanted to kind of point out or get some visual aids to kind of make it easier to see and understand when we're up here talking about what we're creating out there, what we're doing, and then the importance of keeping trash out of our system. And like I said, it's not just the system itself in the ditches, but in the neighborhoods that cause issues. So I just wanted to point that out, you know, brief the board on that, and for the benefit of the public to kind of see what we're doing out there. So, okay.
Before you move on, though,
Yes,
just
sir.
want to thank you for these rain events that have happened in south part of Precinct 1. You know, your team was there till midnight working on the project and alleviating a lot of the flooding in our neighborhoods over there. So I just want to thank you and your staff for the sacrifice of time and effort in being there, especially late in the evening, to relieve that flooding. So thank you.
Yes, sir. You're welcome. And just to follow up on that, Commission, since it is a drainage improvement, we are pretty much wrapping up the improvements there, the crossing that we did, and with your staff did another improvement south of us that helped get water into the system quicker, and we improved the ditch itself. And yeah, definitely with both teams, your staff and ours, we were able to get the drainage in place that's needed. And, you know, hopefully if we get another event, the water will move out quicker now that some of the improvements that have been done. But sure, appreciate that. Thank you for the Commission. Judge, if I may, item 6.
Yeah, please.
Thank you. Requesting approval for a 10-foot City of Donna utility easement as it relates to the KVS commercial drain, and authority for the chairman of the board to execute documents.
Move for approval.
Second. Those in favor, say aye.
Aye.
Aye, motion carries.
Item 7, requesting approval to issue payment as claimed for invoice number 74227996 in the amount of $510 for equipment repair and maintenance service performed by Safety Clean Systems, Inc.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item 8, 2013 bonds. Application for payment number 2 in the amount of $90,246.60 from Vencer Contractors, LLC, pertaining to construction contract number ACDD 1 1702300530, Precinct 2, Plano Vista Subdivision, Unit 2, Street and Drainage Improvements. Project engineer Cruz Hogan Consultants.
So
Please,
moved.
in order.
Second. Those in favor, say aye.
Aye.
Aye, motion carries.
We do have some items.
Pursuant to 551-071 and 072, need a motion to proceed to executive session.
So moved.
Second. Those in favor, say aye.
Aye.
Aye, motion carries. We are back in open session.
Yes, sir. Open session, item 10A, real estate acquisition, will proceed as directed. And item 10B, pending petition litigation, no action. 10C, no action.
Move to adjourn.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries. This time we're going to be convening a regular Hidalgo County Commissioners Court meeting for today, October 17, 2017. The entire court being present, we have a quorum. Please join us in our Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Dear Father in heaven, thank you for this day. Thank you for all the blessings you send us. Please help us to appreciate everything that's around us that we take for granted. Please, dear Lord, bless this court. Bless the people of Hidalgo County. Bless us and help us always get through whatever problems we have. Thank you, dear Lord, for living in a free country, for letting us live in a country that's free. Thank you for all the people that help keep us free. And we ask you to bless our families And we ask all of this in the name of the Father, and the Son, and the Holy Spirit. Amen.
Amen.
Any concerns with the consent agenda?
No, sir. Everything's good.
Move for approval of consent agenda.
Those in favor, say aye.
Aye.
Aye, motion carries. Let's see, I've been requested that we move up certain items. The first one is item 20A.
Yes, Judge, and as we are preparing, we're going to ask the Robert Vela basketball team, along with their coaches, Coach David Keith, as well as Coach Homer Gar, to come up. And Judge, we'd just like to take a moment just to recognize the service of our young youth in the time of need. And before I do, David Keith, Coach Keith and I go back a long, long way. More than 30 years of a friendship. Matter of fact, we enlisted in the Army together. And it's just such a pleasure to see him back in Edinburgh. He was at the Sharyland ISD for many years, and we're so grateful to have stole him and back in Edinburgh. And he's with Robert Vela now. And on the when we had the occurrence of the Hurricane Harvey coming through, not knowing where it was going to go, these young men, along with their coaches, came and assisted the precinct in the preparation of sandbags. And we didn't want to go unnoticed. We thank you for your service, young men. The leadership of their coaches to come out and just have a helping hand. At that time, we served thousands with sandbags, but again, we didn't want to go for it to go unnoticed. We want to thank you for your service, for your help, for your consideration. More so, thank you for your leadership, David and Coach. We really appreciate it, and we just want to take a moment just to recognize you all and give you a token of our appreciation for the help. Thank you very much. And if you'd like to share a little bit, David.
No, well, thank you. These are 6 of approximately 90 kids that we have in 2 athletic periods. What I would like to do is show them the opportunity to help the community in every way they can. Even sitting here in this court and being able to watch the process, how things go down, even with the drainage district, it's an amazing process what you guys do, and what you do for the community is incredible. So it's an education just to come here. It's probably more valuable than some of the things they have to sit through on a daily basis. This is fantastic. So for us to be able to help, and if there's anything in the future, like I've told you, your friendship's been a blessing. If there's anything in the future that we can help and our little army can help you with, we will be there in every possible way, provided it's safe, and the way that you guys were able to that your area was clean and safe, and it was amazingly set up for something like this to happen. So thank you for the opportunity.
Right. Thank you, Coach.
Coach, thank you.
So we'll line up for a picture now. Half on the chairs in the center.
I see you're in for the meeting.
Trying to avoid the donut.
The cream filled. Did you see I eat around the cream? Have you seen that place in Mission? It's not Estancia or something like that. They do a mollete and they put cream in the middle. It's crazy.
Not you, but everyone else come in. Not you guys. Everyone else come in a little bit more.
Tighten up.
Great, thank you. Okay, on the count of 3. 1, 2, 3. Let me take a couple more, please. 1, 2, 3. And one more. Oh, gosh. Sorry. 1, 2, 3. Thanks.
Thanks, Coach. Appreciate the help.
Nice to meet you.
Thank you for your help. Appreciate it. Thank you very much. Thanks for your help. Thank you for your help. Thank you. Thanks for being here.
Thanks again. Appreciate it.
Thanks for being here.
Thank you. Good luck this year.
Thanks for being here. Thanks, Coach. Appreciate it. Good luck this year.
The next item is item 9B, under Executive Office.
Judge, can we, 9B. Oh, Beta, yes. Beta, I'm sorry. Shall we? You can please take the podium. We have requesting approval of affiliation agreement for internship preceptorship, program between Hidalgo County and South Texas Independent School District Business Education Technology Academy, also known as Beta.
Good morning.
Morning.
Judge Garcia, Hidalgo County Commissioners, Eddie Cantu, my commissioner. We're very excited that we're going on 6 years that we have been with the county with our 18-year-olds in the business track. And this year we only had one eligible student that was 18 years old, and her passion is accounting. And I would like to thank you for such a wonderful opportunity. Our kids have advanced in so many areas since they've been with the county. It goes on their resume. It's helped them get scholarships, and it's taught them the areas of responsibility, and most of all, there's business in every part, especially the county government. I'd like to introduce you to Pia Matias. Actually, I'd like to brag on her. She was in the International Baccalaureate program, and she told her counselors, no, I want real life experience. I'm dropping my International Baccalaureate diploma, and I'm going to just be an International Baccalaureate certificate student. I want to be in the internship because I'm 18, and Ms. Showery said that maybe I could work at the county, and here she is. Thank you so much.
Good morning, Judge Garcia and County Commissioners. My name is Pia Matias. I'm a Filipino origin, born in Saudi Arabia. My parents used to be doctors there, and 2 years later, I returned back to the Philippines, and I'm currently residing in Edinburgh for a total of 14 years. I'm attending South Texas ISD Business Technology Education Academy, and I'm a senior in the business track, and I'm very grateful to be able to be given this opportunity to apply my accounting skills at the Hidalgo County Purchasing Department.
Awesome.
Thank you.
Very good.
Do they need to vote on the item?
Yes.
Move for approval. Second.
Those in favor, say aye.
Aye.
Aye. Motion carries.
Thank you. Thank everyone.
Thank you. Thank you.
Starting with here.
Thank you for your help.
From one accountant to another. Good luck.
Good to see you.
Nice to see you again.
Thank you for coming.
Oh, actually, thank you.
Congratulations.
The next item that I've been requested to move up is item 9D, as in David. Discussion, consideration, and action on the First Amendment.
Judge, if I may, can we wait 5 minutes? We have Ms. Deborah Getz, who will be here. She will be presenting this item. She is counsel for the county.
All right, then we'll move back to item number 5A.
Good morning, Judge Commissioners. Julia Sullivan with Public Affairs for the record. Item 5A is a proclamation declaring October as National Breast Cancer Awareness Month. And I'll stand to my right, please. Whereas the citizens of Hidalgo County value the benefits of good health as a key component of a long, productive, and fulfilling life, and proudly support observances that focus public attention on crucial health issues such as breast cancer awareness. And whereas breast cancer is the most prevalent cancer and the second most common cause of cancer-related death among Texas women, it's expected that as many as 15,000 new cases will be diagnosed just this year. And whereas it is important to realize that breast cancer does not only affect women, according to the American Cancer Society, about 1 in 1,000 men will be diagnosed with breast cancer as well in their lifetime. And whereas prevention and early detection are the keys to survival, while there are factors known to increase a woman's risk of developing breast cancer, nearly 80% of women diagnosed don't exhibit any of the determinant factors. Early detection of signs and symptoms of breast cancer can increase the survival rate by nearly 95%. And whereas during this month-long observance, all Hidalgo County residents in participation with Doctors Hospital at Renaissance Health System and the Advanced Care Center are encouraged to join in related activities and initiatives that help raise support and awareness of this very serious health concern. Now therefore be it resolved that the Hidalgo County Commissioners Court proclaims the month of October 2017 as National Breast Cancer Awareness Month in Hidalgo County and encourages residents to join in the global fight against this devastating disease. Approved the 17th day of October 2017.
Motion to approve.
Second. Those in favor say aye.
Aye.
Aye. Motion carries.
And joining us is Mario Liscano, Administrator of Corporate Affairs, and he'll introduce his staff.
Thank you so much. Honorable Judge, County Commissioners, thank you so much for providing us this opportunity to bring more awareness to our county and our residents. With me today, I have two of our managers from our health system, Ms. Courtney Hantz and Ms. Christy Esparza, who are helping us in these endeavors. We'd like to also recognize our county clerk, Mr. Arturo Guajardo Jr., who year after year has allowed for our healthcare professionals to go and talk to his department. So we'd like to recognize, seeing that he is here present, also what he's doing for us. We urge all our county residents to please continue for the screening and for any services that are available for detection that will cause prevention. But above all, we thank you for your services, for each and every one of you all. We thank you for allowing us to bring this awareness to the county, and we thank you for, Judge, we thank you for your continued support.
Yes, I think we want to.
It's been approved? Okay, if we can take a photo.
Thanks for being here. Thanks for being here.
I mean, hold on. I mean, my time.
Pink shirt or no?
We need, right? Yep.
Of course.
Dr. Hernandez? Oh, yes.
Mayor. They want you front and center, Mayor.
Smile. Oh, hold on.
Sorry.
1, 2, 3. Smile. Keep your smile. Keep smiling. 1, 2, 3. I'll take one more. 1, 2, 3. Smile. Thank you. Okay, thank you.
All right.
Thank you.
Mayor. Good.
See you, brother. Doctor, ¿cómo estás? Yes.
You want me to move up?
Only if you need them here, Judge.
What is it that you want me to move up?
The executive session.
All right. I've been requested to move executive session up. So pursuant to 551, Chapter 551.087 of, and 551.071 and 072 of the Texas Government Code, I would entertain a motion to proceed to executive session.
So moved.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries. We're going to be in executive session for a short while. All right, we are back in open session.
Judge Commissioners, I'm going to ask that we take, in open session, that we take up item 18A. Yes, 18A, Judge.
All right, sir.
We have the mayor in the audience.
That's precinct number 2.
Yes, sir.
The FAR mayor stepped outside to do an interview on breast
I'm
cancer.
sorry, what was that?
The FAR mayor stepped outside to do
All
an
right,
interview.
he's here.
Here it is.
Welcome to the county mayor.
Good morning. Thank you for having me here. Despite having a Spartan and a Buckeye to my right, that's okay. I still showed up. Thank you very much for having us here this morning. I'm here on behalf of the city of FAR as a mayor, a taxpayer as well, and obviously as chairman of the MPO, and I see my vice chair, Palacios, here with me, to ask the county commission as a whole to please consider reviewing and executing the interlocal that's required for a hike and bike trail. The hike and bike trail, as you know, historically was started from the city of McAllen, and the great Mayor Jim Darling and, of course, Richard Garcia are pushing for it to be a regional project. And under their hospice, when they first started it, under the MPO, they put quite a bit of money in, of taxpayer money, to be sure that the citizens of the McAllen area and Edinburgh area benefit from it. Now we're all going to benefit from it because it's going to go through FAR and San Juan as well. And again, the MPO is stepping up with the county, leading the charge to help us get this done. As a physician, I can tell you there's no better honor to be here before you, pushing forward things that can make our population healthy, that benefit the entire city of FAR and its citizens under the great leadership of the county. So we thank you for that. It is a requirement. It is a necessity. As the MPO chairman, I can assure you, without this interlocal being present of all 3 cities, this project will not move forward, and it's the way it is set right now. I am confident this will go forward because we're all in the same boat. We're all one big family in the county, and we all can see the benefit of it. So on behalf of the city of FAR and the MPO, I want to thank you guys for consideration and your vote on this matter. Thank you.
Okay.
Good morning. Good morning, Judge Commissioners. Before we move to approve the item 18A1, I'm requesting, or Commissioner Cantu is requesting authority to rescind action taken by Commissioners Court on August 16 of 2016, which was a previous interlocal that was approved. So we would need to rescind that action first.
So moved. Second. Those in favor, say aye.
Aye.
Aye, motion carries.
Item 18A2, requesting approval of an interlocal cooperation agreement between the County of Hidalgo and the City of FAR regarding the Regional Linear Park project. At this time, we would ask if we could have approval of the item subject to legal review.
So moved. Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Good morning. I just wanted to.
Armando, haven't the lawyers looked at it back and forth?
They have, but we haven't. Steve hasn't seen the final version. Excuse me. Excuse me. Wow. I'm sure that's going to end up on YouTube for sure. Steve hasn't had a chance to review the final version. I think he got it, but we hadn't heard back from him, and that's why we're...
Mondo,
Yes.
and just a question. All the terms of the original agreement, everybody's in concurrence to the agreement?
That's correct.
Okay.
I just wanted to say for the record that the agreement itself was not attached, so we weren't able to see any the draft or final agreement, and we didn't have a chance to review it or determine if there was any fiscal impact on this one.
All right.
We still got a privilege subject to review?
Yeah, he said subject to leave.
Okay. So, move for approval?
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item 18A3, in accordance with Section 791.014 of the Texas Government Code, we're requesting approval of the interlocal agreement project regarding the original linear park.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries unanimously.
Thank you.
Thank you.
Thank you, Manu.
Judge, Commissioners, then with the next action item, we do have our counsel who just arrived. Commissioner Cantu, you're going to ask
9D?
9D.
Right when I take a bite. Discussion, consideration, and action on First Amendment to interlocal agreement between Hidalgo County and Reinvestment Zone Number 1, City of Donna.
Judge, Commissioner, or Commissioners, we have guests in the audience. I'm going to ask her to come to the podium. And for the record, I do want to clarify something. For the record, the county judge is abstaining from this item and discussion on this item. Ms. Getz?
That's correct.
Okay. Over time, we have worked with the City of Donna and Donators 1 to amend to come up with an amendment to the interlocal agreement to extend the term of the zone, which was a request from the zone because due to the economic downturn that had hit in 2008, they were not able to accomplish what they had wished. And over the course of time in dealing with this zone, a question had come up as to a payment that was due from Hidalgo County to the zone, when that payment should be made, whether it was appropriate. So in the course of putting the amendment together, the parties have resolved the issue that dealt with the timing on that payment by making clear that once this amendment is executed, all of the paperwork will have been provided to the county that is necessary to make that payment. And at this point, we already have confirmation from the attorneys for the zone that they have approved this version of the amendment.
So we're good to go.
We are good to go on it.
Okay. Move for approval?
Second. Go ahead.
Just for the record, also, the First Amendment, the final First Amendment, and the amended plans, project plan, and finance plan was also not attached to the agenda, so we didn't review this either.
Documentation, as always, is going to be presented to the county auditor's office.
Yes, I just make it for the record because if there's any disbursements that are needed as a result of any interlocal or any agreements, we may or may not be able to make them at the time.
Yeah, the documentation will be provided.
Copies had been sent by email to the auditor's office, so they would not have had a lot of time to look at them. They have been sent.
Who was the contact?
It was Letty Chavez.
Yeah, I think we got a draft. We didn't know if that was going to be the final one, and also the plans were not attached to that.
Did you have any other comments?
No, and Ms. Getz, you said that you've been working on this for quite some time. Actually, this is not, I think there was discussion back in February, January.
This has been going on since the beginning of the year.
Right, and discussions with this have been going on since last year, if I'm not mistaken. Okay.
Yes.
I just want to make sure that this is something that's been ongoing for quite some time now.
Mm-hmm.
Okay.
All in favor say aye.
Aye.
Motion carries.
And just to note for the record, the judge abstained, as you
Yes.
said.
For the record, Judge Garcia abstained.
Okay. I know that we've been going, taking items out of order, but.
Which one?
No, I'm just saying in general, we've been taking items out of order, so I think we're back to 5B. 5B.
All right. 5B, a proclamation declaring the week of October the 16th to the 20th as Texas Chamber of Commerce Week.
Yes, sir. Whereas the City of Edinburgh, Hidalgo County, and the state of Texas will celebrate Texas Chamber of Commerce Week this week, October 16th through the 20th, and whereas the Texas Chamber of Commerce Week is designed to celebrate the hard work and accomplishments of chambers of commerce and the communities that they represent, and whereas Chamber of Commerce staff and volunteers work in the service of business to create an environment of prosperity and a place that people love to call home. Their work includes business development, business advocacy, business recruitment and retention, education and workforce development, and community enrichment. And whereas Hidalgo County is proud to call the Edinburgh Chamber one of its chambers of commerce, consisting of 4 staff members, 10 board of directors, 34 chamber ambassadors, and 467 members, and also being home to Leadership Edinburgh, a 9-month program for potential and emerging community leaders that boasts over 465 graduates in the past 29 years. And whereas the Edinburgh Chamber of Commerce has existed in Hidalgo County since the late 1920s and was chartered in 1932, it hosts yearly events including Fiesta Edinburgh, Texas Cookum, Night of Lights, Man and Woman of the Year banquets, and an annual banquet, and several networking opportunities. Now therefore be it resolved that the Hidalgo County Commissioners Court does hereby proclaim the week of October 16th through October 20th as Texas Chamber of Commerce Week, and congratulates the Edinburgh Chamber of Commerce and its longstanding commitment to its community and to Hidalgo County, and encourages the community to stop by their local Chamber of Commerce to learn about the work that they do. Approved the 17th day of October 2017.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
And I'd like to introduce Letty Gonzalez, who's president of the Edinburgh Chamber of Commerce, and she's here with her staff and one of the board members. Letty, and here's the presentation.
Thank you. Good morning, County Judge and County Commissioners. I just want to say thank you for presenting us this proclamation, and I want to thank the business community and our volunteers, who without them we would not be here today. We were chartered in 1932. We have very proud founding fathers. We're very committed to our city and our organizations that we belong to. And I want to thank my board. I am governed by 18 people, 18 individuals who do not get paid. They volunteer their time just like everybody else does in our chamber. I'm very fortunate to have with me 4 staff members. I have a tourism director, marketing special events, and with me today is Ronnie, which is my marketing special events director. I have Martin Rivas, who's my membership director, and manning the office is Imelda Rodriguez, who's my tourism director. So thank you all for giving us this opportunity. I look forward to you visiting our office, becoming a member of our chamber. Most of you are, so I thank you all for that. And if you all ever want to volunteer and give something back to the community, what a better way to do it than to get involved with your local chamber, find out what we do, give time, because time is everything, and donate what you can, because we just don't only do chamber activities or just community events as people think. We give something back to our members, whether it's business seminars, networking opportunities for them to promote their businesses, and a lot of those services is just with them paying their membership dues. So I want to thank you all for supporting us, and you all have a great morning.
Letty, if I may just add, just thank you for what you all do for the community of Edinburgh. I've been fortunate to speak at your leadership classes several times. It's just impeccable what you all do, and just want to say thank you for all that you do for Edinburgh and Hidalgo County.
Thank you very much.
So you can hold this, and then two of you please stand to Commissioner Palacios' right and two to Commissioner Cantu's left.
Thanks for being here. Congratulations.
And you're still here on the insurance, huh?
También.
Okay, item 5C.
Morning, Judge Commissioners. Michael Leo, County Judge's Office. 5C is approval of Chapter 380 Economic Development Agreement by and among the City of Edinburg, Texas, and the County of Hidalgo, Texas. As you recall, we entered into an MOU with the city earlier this year regarding the courthouse project. This just mirrors those terms and puts them into this final agreement, the 380 agreement. It allows us to move forward.
And this has been reviewed by not just our lawyer, but also the Edinburg lawyers, Edinburg City lawyers.
Yes, sir. We sent the final version actually yesterday, which was drafted by the City of Edinburg. We didn't get the final comments, if they had any on that one, to be honest. So I don't know if maybe we can do it subject to legal, just to make sure that we're good.
Move for approval, subject to legal.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Thank you.
Item 6, our District Attorney's Office.
Good morning, Commissioners, Judge. Rosalinda Cantu presenting for the District Attorney's Office. Item 6A, DA Victim Assistance Program Grant Fund 1281. Discussion, consideration, and action acknowledging the interlocal agreement between the Hidalgo County District Attorney's Office and the Lower Rio Grande Valley Development Council.
So moved.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
6B, DA Domestic Violence Specialty Prosecutor Grant Fund 1281. Number 1, approval to accept the Hidalgo County Domestic Violence Specialty Prosecutor Grant from the Office of the Governor in the amount of $119,378.55, effective September 1st, 2017 through August 31st, 2018.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Number 2, approval of certification of revenues as certified by the County Auditor for fiscal year 2017, Hidalgo County Domestic Violence Specialty Prosecutor Grant.
So moved.
Those in favor, say aye.
Aye.
Aye, motion carries.
Number 3, approval to appropriate the fiscal year 2017 Hidalgo County Domestic Violence Specialty Prosecutor Grant funds.
So moved.
Those in favor, say aye.
Aye.
Aye, motion carries.
6C, DA's Title 4E, Fund 1100. Number 1, approval of the Title 4E grant budget, contract number 2394-1008 for October 1st, 2017 through September 30th, 2018.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Number 2, approval of county judge to sign the following documents: A, budget, and B, Federal Funding Accountability and Transparency Act.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
May I proceed with the HIDA task force?
Yes, ma'am.
7A, approval to rescind action previously taken by Commissioners Court on June 27, 2017. Agenda item number 60291 for approval of line item of the 2015 HIDA grant funds.
Approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Thank you.
Thank you, ma'am. Our Sheriff's Office.
Morning, Judges. Morning, Commissioner. I'm Captain Herrera with the Sheriff's Office. Here for this line item in reference to ratification of letter dated September 14, 2017, to request supplemental funds in the amount of $478,245.48 for fiscal year 2015 Operation Stone Garden.
Approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Thank you.
This time we're going to be moving up item number 22A2 under purchasing.
Good morning, Judge, Commissioners. 22A. 1. Approval to exercise the county's option to extend, it would be 22A2. Requesting approval to exercise the option to renew and extend the first of the additional one-year terms as provided in the current contract for the following: Aetna Life Insurance Company and Dearborn National.
Need action?
Yes.
Move for approval.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
B, it's a presentation for Mr. Looney.
Morning,
Judge,
sir.
Commissioners, thank you very much for moving me forward. I apologize, but I got a family emergency I'm going to have to care for. So what I'd like to do is go through the memo real quick. I think you have a copy of the memo. The change, we just approved the Aetna renewal and the Fort Dearborn, which were renewals for the second and third year. The next situation we want to discuss is bariatric surgeries and the possibility of adding bariatric surgery to the health care plan. Several years ago, 4 years ago, we took bariatric surgery out of the plan. The reason we did was because the protocols that were being used to identify those eligible for the surgery were not nearly as aggressive as they should have been, and that it apparently became more of a cosmetic operation than one that was actually as a result of treatment and care of a medical problem. Since that point in time, there's been a number of changes that have taken place, particularly in the protocols that are required. The Cleveland Clinic and the bariatric hospital here at Dr. Hospital Renaissance entered into a partnership. The Cleveland Clinic has identified the proper protocols for the care and treatment to take place for a particular patient. I think that the protocols are strong enough now that we should look at the possibility of adding bariatric surgery back into the plan, but under certain required circumstances. One of the required circumstances is that they follow the protocol as established by the Cleveland Clinic. They're very strict as far as who can be administer the service and how the service is rendered. The second part is to only have that surgery done in a circumstance that's considered a hospital that's considered a center of excellence. The Center of Excellence is a hospital that's gone through very strict standard requirements for the facility, the services rendered, the outcomes, and the actual utilization of that facility. The other circumstance we'd like to see that the individual employee and or dependent be covered under the health plan for more than the standard immediate coverage under the plan. I've extended that. I've asked that to be extended to a 2-year period for both employees and dependents. The last piece is to limit the lifetime maximum to a maximum of $15,000 on a lifetime benefit. The way the plan would work is it'd be subject to deductible initially. Coverage would then be on an 80-20 basis to a maximum of $15,000 under the buy-up plan and a 70-30 plan on the basic plan. Dr. Hernandez is here. As he is performing and worked in the bariatric surgery, if you'd like to hear a statement from him, I'd be fine. He's here. Do you have not as the mayor, but as a doctor.
That's right. Thank you. Yes, before you have documentation, the Bariatric Center at Dr. Hospital Renaissance is an affiliation with the Cleveland Clinic, world-renowned center. Everybody knows for what they do, and they bring that now to the Rio Grande Valley. And we're very proud of that institution and the fact that we have great data to support it. We know in medicine this is no longer a cosmetic issue. This is a medical problem just like heart disease or stroke or diabetes. And there's no other medical therapy that can compare to surgery. Surgery has been proven repeatedly over that this is the only modality that helps people with diabetes when it comes to strokes, when it comes to their weight loss, to maintain it longevity-wise, not just a diet plan for 2 years and then it comes back. This has more than 10 years study. All over the United States have been proven. It helps people be active. As an employer, of course, you don't want your employees missing out work, so they're less likely to miss work. going to their doctors. You will see a return on your investment at 2 years. The data, it's not our data, it's nationwide data. That's when you guys will start seeing your employees going less to the doctors, using less medications, less admissions. So as an employer, you start catching up on those savings. So there is no doubt that the United States is faced with an epidemic of obesity. It is not strictly a Hispanic issue. It is not a Rio Grande Valley or a county issue. It's a nationwide problem. We're addressing it nationwide, and we urge the county to consider it for its population and its employees. And if you have any questions about it, I'd be happy to answer.
I personally can see the benefit. The only thing that I would like to see is possibly changing the years that our staff would need to have worked with us. To me, 2 years, I mean, that's people can come over here and just try to get a job here just to get the surgery. The benefit, I see the benefit. Obviously, it will help with diabetes and other long-term illnesses that put a big strain on our health care.
Well, we're self-insured, Commissioner, so we can set that time frame to whatever time frame you'd like to see. It originally was recommended 1 year, and I said, no, that's not nearly long enough. 2 years is better, but longer would protect us even better from that standpoint.
I mean, like I said, I think there's a huge benefit. I'd like to see it. I'd just like to see it for our employees that have been here for some significant years, 4 years, 5 years, something like that.
We can set whatever limits you would like to see. 2 years is you've got a lot of employees that have worked here a lot longer than 2 years that would be helpful.
And that's why I think that we could put a 4 or 5 year deal.
4 or 5 years is 5 years is reasonable. For current employees. New employees would have to wait a 5-year period.
Commissioners, what are your thoughts on the time period?
Yeah, hold it. Just to be clear, I'm not saying 5 years from now. I'm saying 5 years with the county.
5 years.
So if they've already been here
county.
5 years, that they can
That's correct.
exercise that option.
Yes. And it must have been covered under the medical plan, which means that the dependents would have also had to be covered under the medical plan for that time frame. So you can't just add a dependent now.
Oh, I see.
Even though
Right.
you've been an employee for 5 years, add a dependent that's eligible. That both the employee and the dependent must have been covered under the health care plan for 5 years.
Got it.
Why not just bump it 1 year be enough? I mean, 2 and 1 more would be 3 years.
But I just think more. If you want to do 3 years, that's fine.
3 years would be enough.
4.
Are we going to take them individually? Do we need to make a motion on each item?
For the bariatric surgery, yes, sir.
What's the average cost of the surgery?
From time of initial diagnosis to the finalization of the surgical process itself is under $20,000. The actual surgery itself ranges between $10,000 and $11,500. We're trying to negotiate that to a lower rate currently. So it would be conceivable that they would exceed the $15,000 lifetime maximum.
When we used to have it, the surgery was, if I remember, was over $20,000.
The average surgery 5-6 years ago, average was around $28,000 to $32,000.
That's with no complications at all, right?
No complications. That was just strictly for care and treatment from beginning to end. So that has come down considerably. Plus the requirement of being in the facility itself that is a certified Center of Excellence facility is important because that protects against the potentials of infection, bad surgical procedures in practical operating facilities itself.
But we're putting, is the $15,000 a cap, or what is that $15,000?
That $15,000 is the maximum benefit that would be payable to any given insured for their lifetime.
You want to do
So
3 years,
if I have it
Commissioner?
done, they'd only call the insurance only pay $15,000, and the rest comes out of my pocket.
I'm sorry, say it again.
If I have it done, say, for example, and the insurance only pay $15,000, and the rest comes out of my pocket, right?
Correct.
That's just what I wanted to let people know about.
Does everybody feel comfortable with with a 3-year period, or do you want to do 5, or what's the wishes of the court?
A 3 be all right for me.
I'm fine with 3.
You want to make a motion, Commissioner?
Yes, I need a motion.
Move for approval on 3 year.
Can they procedurally, approve, this is only one item of several items within the medical plan changes? Do they need to can they take them each individually, or do they have to wait and take them all the changes at once?
We're taking them individually.
They can do it either way.
Okay, I just wanted to make sure.
Move for approval on 3 year.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
We have other benefit plan changes that I'd like to then incorporate into one final motion in this process. When we originally started with the Aetna, we asked them to provide the highest profile prescription drug program that they had available. Highest profile meaning we're going to cover everything. We're going to make sure that prescription medications are fully covered so that the transition from one carrier to another carrier, we didn't limit what the prescription medications might be. We also asked them to do a study during that time frame of what we could do to manage the prescription drug cost as associated with the county. Right now, our total prescription drug cost is running about 28% of our total cost of our health care plan. 28% of the total cost of a health care plan. 10 years ago, we were looking at 3 to 4%, 5%. Obviously, this is prescription drugs and prescription benefit management services has become a critical issue. We had them do an evaluation as to what would occur if we were to move medications from a higher cost area to a higher copay area. We have a lot of generic medications that have been increased in price, so that the old concept of generic versus brand, we actually have generics that are more expensive than brand medications at this time. So rather than do a generic brand consolidation, we ask for cost analysis. What cost, based on Tier 1, Tier 2, and Tier 3 medications, should these drugs be applied to? As a result of that, there's a study that shows that if we were to move from the most, the highest cost prescription benefit plan to a lower cost prescription benefit plan, meaning that Aetna has 5 different levels of prescription benefit management. We're at the highest possible 28% level. You can move each level down, changes the medications moving from one copayment tier to another copayment tier, and in some cases eliminating medications. If we go to a tier that's called the value tier, the potential savings in the value tier versus the tier we're in currently is $675,000. What happened is, in that case, we moved from the lowest cost copay of $10 and the low cost copay of $20 to the highest copay of $35. So the report shows that there are approximately 350 people in the county that would be impacted by making those changes, by moving from 10 to 35 or 20 to 35. The other item was that there's 40 medications that would be excluded from coverage. And they would have to then find an alternate therapeutic medication to substitute for the current ones they're using. I took that list of medications that were on that list of medications that would be impacted. There are 18 people that would be impacted with a medication that's used to treat acne. There are 14 people that would be impacted by the use of a ointment for psoriasis. There's of that 90 people that are impacted, of those 40 medicines, there was only 2 that were not eligible. I'm sorry, only 1 that was not eligible on a therapeutic equivalent. So even though you're asking for the individual then to change, the things they're changing on are not they're not critical care circumstances or more maintenance. So this is an if-then circumstance. If we want to save the $675,000 on the prescription drug program, then we need to move to a more efficient cost on the prescription benefit circumstance. We made this change for another company in December of last year. They had 4,000 employees. We followed up with employees through information, meeting with the employee committees and such to find out what the total overall impact was on their organization. They have 4,000 employees. You all have close to 4,000 employees. You're talking about 350 people total being impacted by making this change. So our recommendation is either we stay where we are, possibly move to one lower thing. We've got another one that's not the $675,000. We've got another one that's $600,000 in savings. But that impact is the same number of people that are impacted in the same medications. So moving from one saving up to another didn't make sense. Plus, the co-payments that we're dealing with, a $35 co-payment. That's the maximum co-payment. There are some individuals that would go from 10 to 35. 35 is still a low number in the industry for a high-profile medication. The other thing we did not change is specialty meds. Specialty medications are expensive medications. We did not change that co-payment or co-insurance factor. We left that where it is currently. My recommendation is that we move to the Aetna value plan as far as that.
Are we going to take action individually?
No. So that's item one. The next item we deal with is home health care. The home health care, the way home health care is essentially developed in the insurance industry was to create a circumstance where someone was hospitalized and in a serious condition, to take them out of that setting as soon as possible and move them to a rehabilitation process. The rehab centers were less expensive than being in the hospital. The next stage down from that would be to move them to a home health care setting, so that you move in stages from a high cost to a lower cost to a minimal cost circumstance. The way the benefit plans were set up last year, the home health care became a benefit that was paid at 100% and 120 visits at home. It was not intended, the home health care benefits were not intended to be that process. They were intended to still have a co-payment involved with the service that was rendered at home. So the recommendation is to move the home health care to a requirement that they meet the circumstances of either being hospitalized or having a severe illness or a severe problem that requires a home health care setting. We do have individuals that we helped in a transition process moving forward from Blue Cross to Aetna. We want to grandfather those people that are in that transition process so that they are not reduced in benefits moving forward. But this benefit would be impacted and effective for anyone after January 1st of next year.
What's the cost benefit to that, and how many people would it affect based on last year's numbers?
Ask it one more time, sir.
What's the cost benefit of doing this? Like, how much money are we going to save, number one? And number two, how many people would it affect compared to the people that were served last year?
Well, the home health care unit right now, the home health care benefits are being payable to fewer than 20 people in the county itself. So the savings would be simply moving from, again, a 100% plan to a $35 co-payment plan. We wouldn't know what that was until our experience was generated.
But I guess the biggest restriction is going to be that it has to come from a hospital stay. In other words, if they injured themselves and went to a clinic and needed home health, they're not going to.
It would have to be a serious medical condition, and not necessarily a hospital stay, but a serious medical condition that would require home treatment or could be done at home, as opposed to a rehab center or a hospital.
But we don't know how much the savings potential is. I'd hate to take a benefit away when it's not costing us very much money.
Well, that's why I say we're grandfather those individuals that are currently in the plan. Let them they're currently being paid on that benefit. We grandfather them in so that they continue on that basis. But after January 1, we would need to have, and the other thing that goes along with this, Commissioner, is that there has to be a treatment pattern. There has to be a specific treatment pattern for the individual that's receiving care. So if they're receiving care for occupational therapy, there's a pattern, that there's a treatment protocol that's established in that community. They have to follow that protocol, show that there is a circumstance where they're improving in their therapy, that it's not simply a maintenance process.
Who determines that? Our staff does, doesn't it?
The Aetna is responsible for making those determinations. Once a quarter, they send out a request to the physician treatment person, whoever the physician is. They send them a required report. They have to have the initial protocol established. This is what our program is. This is what we're going to accomplish. This is what our standards are. They have to meet those qualifications on a quarterly basis.
But we can still accomplish that without having the restriction that people must be in a hospital stay.
Correct.
Okay. And then the last one?
The last one that we're dealing with is the buy-up plan and the basic plan. The basic plan and the buy-up plan on therapies. The buy-up plan is supposed to be a greater benefit for the individual than the basic plan. The basic plan for speech therapy, occupational therapy, the other therapies involved, waived the deductible, and then were paid at a co-payment base. The high plan required satisfaction of the deductible and then was paid on an 80% basis. We need to get those two plans in line with each other. So we want to set the therapies to be not subject to deductible, waive the deductible on the therapy, and then have them paid at the same basis that an office visit co-payment would be paid. So under the basic plan, that would be $40 per visit. Under the buy-up plan, it would be $35 per visit. Deductible waived in both circumstances so that both plans are equivalent as far as the manner in which the benefits are calculated and consistent with what an office visit co-payment would be. That actually increases benefits in some cases. Because currently the co-payment for the basic plan for those services is $50. That will reduce to $40. And the buy-up plan is $40. That's reduced to $35. I think that's the right number.
So what's your recommendation on that one?
Recommendation is to make both benefit plans consistent with each other.
I'm sorry, to do what?
Make them consistent in the benefit pattern with waiving deductibles and subjecting it to an office visit copay.
You're still talking about the home health care benefits?
No, this is the therapy. It includes autism. It includes all of the speech therapy, occupational therapy.
So right now, if one of our employees needs any type of those therapies, every time they go to a visit, they pay $50?
Under the basic plan.
What does Medicare charge? Doesn't Medicare, not that they charge, that they cover about $50, so we're basically paying 100%?
We're secondary to Medicare or something
Right,
like
but if somebody had Medicare or Medicaid and they went in for treatment, I think Medicaid would probably pay the therapist around $50.
It's possible, but the Medicaid is a completely different negotiated fee basis through the providers.
Right, but what I'm trying to say is that if our employee that makes $24,000, them themselves or their dependent goes in for therapy, every time they go in for therapy, they're going to have to pay $50 out of their pocket?
That's being reduced.
To what?
To nothing. How much? 35.
35 under the buy-up plan and 40 on the basic plan.
And when we had Blue Cross Blue Shield, what was the number back then?
Back then it was 50.
Okay. So it's not something that we're increasing from
No,
0 to
we're
50?
actually increasing
Okay.
the benefit. Yeah. Particularly when they waive the deductible so that it's subject to a copay immediately.
My only concern is on the home health that we're requiring somebody to go to the hospital. Can we take that out since we don't really have numbers saying that that would be a huge savings?
We can take that out, but still have in it that you require a significant care and treatment for an illness or surgical procedure.
I like the part where you said where our staff's going to administer whether somebody's improving or not. I think that's sufficient.
We get that report on a quarterly basis.
So long as we have that, I think that we're okay. That we don't need to limit it to severe and hospital as a prerequisite for treatment. I mean, you could tear up your knee without having to go to a hospital, or that's not going to be considered severe. You know what I mean? And then,
well, you know, the definition is broader than that. You can, if you've got a torn up knee, you can't, get to the doctor's office. If you can't get to a facility, if you can't go to a physician circumstance, then you pay the same co-payment to have that person come to your home as you would have if you went to the doctor's office.
right, I'm fine with a copay. I just want to make sure that they're able to get their treatment, their service at home, not requiring them to have had to go to the hospital first. Does that make sense?
Yes, sir.
But I'm fine with a copay.
Well, what if they only go to a doctor's clinic and they send them home and they tell them to get therapy or something like that, instead of going to hospital?
It's a flexibility. We can make it as broad or as limited as necessary. Unfortunately, we want to make it into such that is a circumstance where the individual does not have the ability or does not have the capacity to go to the doctor's office.
But it's not a doctor's office, it's therapy, so it's more
therapy,
a therapy clinic.
setting. So they bring the therapist to the home.
Which they cost about the same.
Pretty close.
Yeah.
Some of the therapists don't even have offices.
I'm fine with all of it. We could just remove that.
No problem. You need action?
Yes.
Move for approval.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
With the removal of what?
Of needing to have hospitalization first.
I'll have it done.
Thank you.
Any other questions? Judge, thank you very much for the opportunity.
Thank you, Gary.
Thank you.
Do we need, those are changes, do we need item D?
We just voted on item D.
Well, you voted twice on the
We just
changes.
did B, right? Or
Well,
C?
we'll just vote on item D then.
Let's vote on item D.
Well, the judge hasn't called the vote on the other one yet. The one we just voted on. It was a motion and a second, and I was waiting for him.
No, we voted.
We voted.
Yeah, all right.
But my only question is, do we need item D?
So moved.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
Thank you all.
Judge, Commissioners, under item 9A, there's nothing to report this week.
All right, let's move on to 9C then.
9C is approval of an open cut right-of-way permits for Precinct 1. This is Salazar Utility Construction, Speedy Gonzalez Acre Subdivision, Mercedes, Texas. First one is proposing a 4-inch sanitary sewer service line connection to an existing sanitary sewer line an age of pavement is approximately 1,647 feet south of mile 9 north center line.
So moved.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Second is proposing a 4-inch sanitary sewer line connection to an existing sanitary sewer line under pavement approximately 3.19 feet from edge and approximately 1,906 feet south of mile 9 north center line.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Third is proposing a 4-inch sanitary sewer line connection to an existing sanitary sewer line under pavement approximately 5.48 feet from edge and approximately 2,170 feet south of mile 9 north center line.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
And Judge Commissioners, for the record, all repairs will be as per county requirements and specifications.
All right, item 10.
Mr. Silguero.
Morning, Judge Commissioners. Raul Silguero presenting for Executive Office and the Department of Human Resources. Item 10A, we do have some items that require a waiver of the budget amendment policy for personnel-related amendments, so I'm requesting a waiver, please.
So moved.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item B, Judge Commissioners, approval to waive the 2018 contribution donation of sick leave hours to the sick leave pool for currently enrolled participants due to our current balance. Employees not currently enrolled and who wish to enroll must contribute sick leave hours as per the sick leave policy. Judge Commissioners, this is the third year. We have a balance of 193,000 hours. We use about 6,000 a year. So we have a substantial balance that should last us a few years. So what we're doing is current employees don't have to donate time to participate. We just waive that and only require new people who are not currently participating to be able to join the pool.
All right.
So that's
You need action?
Yes, sir, please.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item C, for the Public Defender's Office, they have a vacant position for which they hired a temporary pending resolution of an issue there, and we're asking only to extend this temporary part-time position effective 10/23 through 12/31, and the position is temporary slot 023 at Clerk 1 at an hourly rate of $12.12 an hour.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item D, for the District Attorney's Office, for the DA Border Prosecution Unit grant, approval of the following personnel actions effective next full pay period. The District Attorney is asking that we delete an auto allowance for slot 0087, 3,600, and to create a new position, slot 006, Criminal Investigator 2, and add the auto allowance to that position. The salary for the slot is $56,650, and the auto allowance would be $3,600. And then the next item is to create slot 007, Administrative Assistant 1, at $27,000 for that grant.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item E, for the Office of the County Clerk, approval of the following personnel action effective next full pay period. Mr. Guajardo is asking that we delete slot 0071, titled as Collections Enforcement Officer 2 at a salary of $31,252, and in lieu of that, to create slot 0078, a Deputy County Clerk at a salary of $30,676.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item F, for the Elections Department, we're asking approval of the following personnel action effective next full pay period. The Elections Department, with Mr. Guerra's approval, is requesting that we create slot 0194, Election Surveyor. This is to meet a stipulation and agreement we reached with the Department of Justice. This position is to ensure that our polling locations are ADA compliant. It's a requirement that during election days that all the sites be visited to ensure this. So we're asking for that position at a salary of $33,755, subject to funding.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
And that's all I have. Thank you, Judge, Commissioner.
Thank you, sir. Item 11, Urban County.
Good morning, Judge, Commissioners. P.R. Avila with
Irving County Program. For item 11A, subject to compliance with House Bill 1295, when and if applicable, Irving County Program on behalf of Precinct 3 is requesting a construction in action to award and enter into construction contract with Moreville LLC in the amount of $1,206.39 for the Texas General Land Office, Round 2.1, Penitas Drain Phase 2.
So moved.
And this is also, it's already been approved by legal pending the payment of performance bonds.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item 11B, requesting approval of a program amendment for the City of Alamos fiscal year 26, which is 2013 work plan. This amendment will add the following scope of work: the installation of approximately 4,600 linear feet of an 8-inch PVC water lines to Regency Acres.
So moved.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item 11C, request approval to remove fixed assets listed in Exhibit A from the program's inventory list.
So moved.
Those in favor, say aye.
Aye.
Aye, motion carries.
Thank you.
Thank you, sir. Item 12, our Health Department.
Good morning, Judge Commissioners. Eddie Olivares, Hidalgo County Health Human Services. Item 12A, Healthcare Funding District under 12A1, discussion and action including but not limited to healthcare funding district and/or expenditures. There is no action there, sir, unless you have any questions. Sir, under item 2, and I need to, just for clarity, there's always questions about this. This item is a discussion and consideration and approval to draw down funds for final demonstration year 6 of uncompensated, UC stands for uncompensated care payment, and the amount to be determined by the Health and Human Service Commission of the state of Texas. Instructions from the Local Provider Participation Fund, the LPPF, with a transfer date of October 18, 2017, and a settlement date of October 19, 2017, for the amount of $1,723,108.01. That's $1,723,108.01. This is part, just for the explanation, 3 sessions ago, Senate Bill 1623 allowed the hospitals to contribute into the fund, that their money would be multiplied and returned back with the multiplier to assist with uncompensated care and DSREP program. This is the uncompensated care side. That funding does not impact general fund. It does not come directly from our county coffers. This is specifically from the hospitals. That's collected by Mr. Varial in his office and then submitted into an account through Ms. Norma Garza, county treasurer, and then that it was submitted back to the feds so it could be multiplied and returned back to the hospitals.
So moved. Approval. Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item B is approval of the certification of revenues as certified by the county auditor for the Local Provider Participation Fund and the amount to be determined, which is $1,723,108.01 by HHSC in final instructions.
Approval. Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item C is approval of 2017 appropriations of the funds for the Local Participation Provider Participation Fund in the amount to be determined by HHSC, which was $1,723,108.01.
Approval. Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item B, sir, Indigent Healthcare Program. B1, there is no action unless there's questions or comments. Thank you very much. Have a good day.
Item 13, Emergency Management.
We could come back when Valde gets here.
Yeah.
Let's move on to item 14, our Community Service Agency.
Yeah, well, he's
Go
back to the previous.
Just a minute, Jaime.
Yeah, it's on the emergency management?
Yeah, just.
All right, sir, go ahead.
Pepe Caso for Precinct 4. I think Chief Saldana is out of town because he was responding to a need for some supplies and some manpower up in Corpus Christi. So I think he's handling that, and Precinct 4 and Precinct 1 are providing some staff and equipment to assist with the debris management over in Corpus Christi.
So are you heading this item, though, the one for discussion? 13A.
Discussion, consideration, and approval of cash compensation for overtime hours physically worked by non-exempt county employees that were directly involved with the TDM response for Hurricane Harvey mutual aid assistance to be included in the employee's paycheck for the next available pay period in accordance with the Hidalgo County Civil Service Commission rules and the Hidalgo County Personnel Manual.
Move for approval?
Second.
Now, this will apply to everybody, not just precinct 4, am I correct?
Yes.
That's correct.
Yes.
Everybody that works for the county.
Right. All right, those in favor indicate by saying aye.
Aye.
Aye, motion carries.
Thank you.
Okay, item 14.
Item 14A, Judge Jaime Longoria with Hidalgo County Community Service Agency. It's discussion and possible action to extend assistance to Galveston County Community Action Agency through October 31st. I just wanted to do a brief presentation, Judge. As you recall, Commissioners and Judge, you all, under Chief Saldaña's order for mutual aid to counties requesting assistance for Hurricane Harvey, the Community Service Agency was included in that order. We were asked by Galveston County to provide some assistance in their service area, which is a 4-county area on the coastal bend. That would be Fort Bend County, Wharton County, Brazoria County, and Galveston County. For the last 3 weeks, under a memorandum of understanding that was signed, we provided assistance in Brazoria County and in Fort Bend County. And I just wanted to do a brief PowerPoint just to kind of show you some of the activities of our folks in those 2 counties. You guys recognize the cycle for the disaster recovery plan. Certainly we're involved in a little bit of the planning. We're not involved in any of the disaster response. We're not first responders. We're not out there immediately after the hurricane, but we're involved in the last part of the disaster recovery cycle, and that is the recovery part. What we found was incredible devastation. Batteries are dead. What we found was incredible devastation in Fort Bend County, the first county that we were deployed to. That was in the city of Richmond and the city of Rosenberg. And I wanted to go ahead and flip through that. What we did, what you're seeing is a picture of our employees. We actually deployed 5 employees and myself to the city of Rosenberg and the city of Richmond. That picture was actually taken in the library. We were able to set up and provide services and interview clients. The Community Action Agency in Galveston had very limited staff resources. So rather than train new employees and hire new employees, we were able to utilize our employees who have that experience. We're a very mobile group. We have laptop computers and all the latest internet gadgets to be able to work in any particular area of that we're deployed to, so we're able to provide services there. And I'm going to give you a breakdown of those numbers in just a second. The counties, what you have in front of you is a chart showing the counties and the folks and the families that were assisted. In Fort Bend County, we obligated over $77,000. We're able to assist over 167 families. In Brazoria County, we were able to assist with $119,000, obligating that with 215 families. We obligated roughly 50% of Galveston County's funding in the 3 weeks that we were there. So we were a big part of their assistance to the folks in those four particular counties. Just to give you a little breakdown of the report that you have in front of you, roughly 18% of the folks that we assisted were over the age of 55. That's a vulnerable population. We're able to identify them and bring them in and provide assistance. We're also able to provide assistance to 39% of the folks that we provided assistance to were children under the age of 18. The types of assistance that we provided was monetary assistance. We were able to give out money for clothing, medications, food stores that may have been destroyed, gasoline in some cases. We found a lot of folks that had a lot of lost wages. We had, as far as the households, 74% of the folks that we helped, their households were under 100% of federal poverty. So we like to think that we were assisting the most vulnerable of those families in those particular counties. 12% of the families that we assisted had no income source at all. So we were able to provide assistance, once again. Just some pictures of some of the devastation. In Richmond, the city of Richmond, we found a whole community that was wiped out right on the banks of the Brazos River. What you see on the second picture up on my right, which would be is the city of Richmond allowed us to use one of their emergency trailers. So we were able to deploy right on the river banks, and the families came out to receive assistance right there from us. And that, of course, is a picture of the trailer and the emergency management vehicle that we were able to utilize. More pictures of folks coming out. What you have is a picture of the fire marshal in the city of Richmond. And the city of Richmond was very grateful, of course, for the assistance that we provided to their citizens. More pictures. What you see over on my right, again, is a picture of the library. There's also a picture of we're able to set up in a church and at a parish hall. So we provided assistance to folks in a church. We also actually deployed into an apartment complex, and we set up in a little office. So we had a variety of different scenarios. We took this as an opportunity to train our staff in being able to work pretty much in any condition that's safe for them. More pictures. Up on the left, you'll see actually working out of a hotel. Up on the right, again, is the apartment complex. And then, of course, the emergency trailer that we were able to use in Richmond. So we were in Richmond, Rosenberg, Lake Jackson, and Angleton is where we provided services. The current agenda item is asking the Galveston Community Action Board of Directors has asked us to go back for one more week and provide assistance, mostly around the city of Dickinson, that was also decimated because of the storm. So that's the item that you have in front of you today, Judge and Commissioners. I'll entertain any questions.
How many staff people are you going to be taking it there?
We'll take our staff of 5 again, plus myself. It'll be the four eligibility specialists, our IT person, and then what I do is I'm kind of the logistics person, go back and forth. I make contact with the cities and the counties to make sure that we have.
This, right?
Pardon me?
Approval.
Second.
Those in favor, say
Yes.
aye.
Aye.
Aye. Motion carries.
Thank you, Judge. Thank you, Commissioners.
Item 15, our elections office.
Good morning, Judge. Good morning, Commissioners. Yvonne Ramon with Elections. Item 15A, an update for elections. Of course, the elections are starting this Monday, October 23rd. I invite everyone to go out there and be aware. We have got 7 constitutional amendments, and for anyone that needs a bit more explanation, they can, of course, call my office and also go under votetexas.gov. The Secretary of State puts out what are called explanatory statements and gives us a little bit more leeway into understanding what that proposition is. So I invite everyone to either call or go on that website. Keeping in mind that we also have 6 additional city elections and 1 school district election that will be joining the constitutional amendment. So let's be aware and let's be informed. On item B, we have 2 changes, and you have been given the proposed early vote sites and the election day. During early vote, we are needing to move Mercedes Civic Center to the Mercedes City Hall. They are making changes to the Civic Center, and it's not usable. The Penitas Annex Meeting Room, the same. We're moving to the Penitas Public Library. So I ask for discussion, consideration, and approval of those changes to the August 8th approved list of the November 7th, 2017 constitutional election early voting polling sites.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye. Motion carries.
Thank you. On item C, A1 61938 is approval of the 2017 November constitutional election services contracts between Hidalgo County and the City of Weslaco, and number 2, Hidalgo County and the City of Hidalgo.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye. Motion carries.
Thank you very much.
Thank you, ma'am. Item 16.
There's no action.
Oh, I'm sorry, Commissioner.
I'm sorry. Yeah, no action until next meeting.
All right, sir. Item 17, Precinct 1.
Morning, Judge, Commissioners. requesting approval to accept the counteroffer to purchase a tract of land known as Parcel 6 associated with Mile 6 West Road Improvement Project.
Move for approval.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
Thank you.
Item 19, precinct 3.
Good morning, Judge Commissioners. Victor Gallardo with the Office of Commissioner Flores.
Morning, sir.
Item 19A, TxDOT Precinct 3 requesting acceptance and approval of an advanced funding agreement, amendment number 1 between Hidalgo County and Texas Department of Transportation for Mile 3 North, Goodwin to Tom Gill Road, with the authority for the county judge to sign all required documents.
Move for second.
Those in favor say aye.
Aye.
Aye, motion carries.
Item 19B, requesting approval of an interlocal cooperation agreement between the City of Palmview and the County of Hidalgo concerning certain improvements to Veterans Boulevard from IH2 US 83 to La Homer Road.
Move for approval. Second.
Those in favor say aye.
Aye.
Aye, motion carries.
B2 of 19 is in accordance with the section 791.014 of the Texas Government Code, requesting approval of the interlocal cooperation agreement project regarding certain Phase 3 road improvements to Veterans Boulevard from IH2 US 83 to La Homer Road, a section within the city limits.
Move for approval. Second.
Those in favor say aye.
Aye.
Aye, motion carries.
19C, number 1, requesting an approval of an interlocal cooperation agreement between the City of Peñitas and the County of Hidalgo concerning Phase 3 road improvements to Mile 3 corridor from FM 492 to FM 2221.
Move for approval. Second.
Those in favor say aye.
Aye.
Aye, motion carries.
And again, 19C2, in accordance with Section 791.014 of Texas Government Code, requesting approval of the interlocal cooperation agreement of a proposed project regarding certain Phase 3 road improvements to Mile 3 corridor from FM 482 to FM 2221, a section within the city limits of said city and in part with county jurisdiction.
Move for approval. Second.
Those in favor say aye.
Aye.
Aye, motion carries.
Thank you.
Thank you, sir. Item 21, our Budget Office.
Morning, Judge, Commissioner Sergio Cruz, Department of Budget Management. Item 21A is discussion and action to authorize Valde Guerra, the County Executive Officer, to sign certification of tabulation of utility adjustments for the State Highway 364 right-of-way project.
So move.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
Item 21B, 1 and 2, approval of revised Title 4E Child Welfare Service grant budget for the period of October 1st, 2017 through September 30th, 2018, and approval for the judge to sign the required documents.
So move.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
On item 21C is approval of medical coverage as per the Affordable Care Act, IRS Code Section 4980H for the 4 temporary employees as listed on the agenda.
So move. Second.
Those in favor say aye.
Aye.
Aye, motion carries.
Thank you, Judge, Commissioner.
Thank you, sir. Item 22, purchasing.
Good morning, Judge, Commissioners. 22A.
Morning.
One, approval to exercise the county's option to extend in the amendment form for 1-year term under contract C13-177-07-23 for the lease office space for Urban County program under the same rates and conditions.
So move.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
Item 22B, I'm going to take no action on that. 22B1, no action. 22B2, requesting exemption from competitive bidding requirements under the Texas Local Government Code.
There was no action on 1?
No action on 22B1,
All right.
A and B.
All right, on 22B2, I'm sorry, go ahead.
Yes, 22B2, requesting exemption from competitive bidding requirements under the Texas Local Government Code, Section 262024 for professional services.
Move for approval.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
B, presentation of scoring grid of the firms graded and evaluated through the county's approved pool in connection with the professional engineering services for Precinct 1 Midway Road Project.
Move for approval.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
C, authority for the purchasing department to negotiate a professional engineering service agreement commencing with a number 1 ranked firm.
So move.
Second.
Those in favor,
And Judge,
say aye.
If I can ask for the record to state, for them to state the number one ranked firm, for the record.
Alpha Infrastructure.
All right. Then
22.
I believe a vote was taken.
No, I think you said motion second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Precinct 2, 22C1, requesting approval of work authorization number 1 with an estimated cost of $19,998.90 as submitted by the project engineer B2Z Engineering to provide engineering design values for Precinct 2 Industrial Boulevard and Valmex Drive Road projects. Contract C-17-229-0822.
So move.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item 2, requesting approval of work authorization number 2 with an estimated cost of $249,932.04 as submitted by project engineering B2Z Engineering to provide PSNE, including pavement, traffic, signal, bridge, design, and utility coordination for Precinct 2 Military Highway through contract C-17-182-0613.
So move.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
22D, Precinct 3. It's requesting approval of change order number 1 to decrease PO number 760388 by $1,166.39 for Haircon for the removal and replacement of shingles at the Ansaldoa Park Pavilion.
So move.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
22E, Precinct 4, requesting, item 1, requesting approval of a professional service agreement, C-17-282-1017 with LNG Engineering for on-call geotechnical construction material testing service for projects located within Hidalgo County, Precinct 4.
So move.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
22E2, requesting approval of certification of substantial completion submitted by Rigney Construction and Development for M Road building improvements as submitted and certified by Engineering Half and Associates, contract number 2016-321-1004.
So move.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item 3, requesting approval of change order number 2 in the amount of $50,000 with an increase to original contract in the amount of $493,500 for the recovery and motor pool improvements project in Precinct 4 as submitted by Synergy Builders of Texas, contract C-17-067-0321, and is approved by the project engineer Heaven Associates.
So move.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
Item 4, requesting exemption from competitive bidding requirements under the Texas Local Government Code, Section 262024, professional services.
So move.
Second.
Those in favor, say aye.
Aye.
Aye, motion carries.
B, presentation of scoring grid of the firms graded and evaluated through the county's approved pool of professional architectural services for design and development of Brewster Park in Precinct 4.
Move for approval.
Second of the Warren Group as the highest.
Right, the
ranked
Warren
firm.
Group Architects.
Those in favor, say aye.
Aye.
Aye, motion carries.
C, authority for the purchasing department to negotiating professional architectural agreement under AIA form with the number 1 ranked firm, which is the Warren Group.
So move.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
22F, the IT Department. Item 1, requesting approval to purchase cloud-managed switches along with necessary components, licenses, and support through NetSync Network Solutions, an authorized reseller for Cisco systems through DIR contract in the amount of $162,331.15.
Move for approval.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
Item 2, requesting approval to amend the participation agreement with Tyler Technologies in the amount of $30,381 to add record of appeal feature for Odyssey.
Move for approval.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
Thank you.
Under open forum, did anybody sign up?
Yes, sir, we have 2 participants. I will remind the audience to please respect the speaker's time at the podium. There's a 3-minute time limit. I will advise when there's 1 minute left. Our first speaker is Ms. Fern McClary. Okay. Then we have Ms. Virginia Townsend.
Good morning, or is it?
Morning.
Almost not. I got all my questions answered today except one, and that's because I didn't get to talk to Baldy. I wasn't clear, and I don't think you ever got back to me. When purchasing becomes very specific in their requirements, whether it's John Deere tractors or a certain kind of, I think there was some 18-wheeler something or another. Every time I look at it, it's so specific, I'm not sure anybody else could bid on it except that particular company. So I thought that was against the law, so I asked Baldy, and well, anyhow, you're not supposed to answer me now, but.
Judge, Commissioners, I clarified it. I do have a response. Unfortunately, that next court session, I didn't see Ms. Townsend, so I'll get with you.
Okay. But I know back when my husband was in the business, and they really got upset when somebody made a bid for a specific tractor that absolutely no other tractor company could fill except that particular one. And to them, that was totally not fair, and I think it's not fair either. So I don't know if we're always careful about that, but when we get so specific that we line out exactly what we want, and then we name the tractors, for goodness sake, John Deere, I don't know. If that's our policy, I think we ought to change it, but that's my opinion. Thank you.
Thank you, ma'am.
There are no more participants for open forum, and I am going to ask the court to go back into executive session.
All right, pursuant to 551-071 and 072, need a motion to proceed to executive session.
So move.
Second.
Those in favor say aye.
Aye.
Aye, motion carries. All right, we're back in open session. Mr. Guerra.
Thank you, Judge, Commissioners. Open session 26 under real estate acquisition appropriation for sale, no action to be taken. Pending and or potential litigation under open session, no action to be taken. C, deliberation regarding the following economic development negotiations pursuant to Chapter 551, Texas Government Code Section 551.087, Project Fair. Proceed as directed at this time. And item D, the claim of Florentino Vasquez. Judge, Commissioners, I'd like settlement authority to make an offer in the amount of $2,066.51.
Move for approval.
Second.
Those in favor say aye.
Aye.
Aye, motion carries.
And for the record, Judge, Commissioners, if accepted, I will be requesting the auditor to make the check out to Karam Law Firm. Judge, Commissioners, there's no need to go back into closed session. And we will be having Commissioners Court next week on the 24th.
Motion to adjourn.
So moved.
Second.
Those in favor, say aye.
Aye.
Aye. Motion carries. Thank you, gentlemen.
Thank you.
Judge, thank you.